How do you recognize and manage thyroiditis or inflammation of the thyroid caused by immune checkpoint inhibitors? What should patients be on the lookout for? In general, patients undergoing immune checkpoint inhibitors can affect any organ by causing inflammation throughout the body. This includes glands that produce hormones such as thyroid. Thyroid inflammation can be subtle. So some symptoms that you can feel are you can feel hot, cold, tired, anxious, etc. It is very important to tell your practitioner right away if you have any symptoms that could suggest thyroiditis or inflammation of the thyroid. It is particularly important to watch out for symptoms of what's called thyroid storm. These include mental status changes, elevated heart rate, elevated blood pressure, elevated body temperature, compromised organ function, change in behavior or mental status changes. Some management of hyperthyroid is, in general, if not symptomatic, we will continue to just monitor labs. Symptoms can include jitteriness, heat intolerance, weight loss, or palpitations. For symptoms, if bothering patients, we can give a beta blocker or hold immunotherapy. Providers can also consider giving corticosteroids if patient is in acute thyroiditis. Patients who are often hyperthyroid can eventually become hypothyroid after a period of time. The way you would manage hypothyroidism is patients are usually given a medication called Synthroid or levothyroxine. These are prescribed depending on level of TSH or the thyroid stimulating hormone. This is generally taken in the morning on an empty stomach, which is best absorbed if given 1 hour before eating or drinking. There will be frequent monitoring of labs, which include thyroid stimulating hormones, free T4 or free T3 to make sure replacement is working. This can also be managed by an endocrinologist, and a referral can be made if necessary. Some positive notes about this side effect is usually can manage without having to discontinue checkpoint inhibitor therapy. While this often becomes a lifelong condition, it is very manageable.